Blood cancer is a complex group of diseases. It affects the blood, bone marrow, and lymphatic system. These cancers develop when abnormal blood cells grow out of control. This uncontrolled growth disrupts the body's normal blood cell production. Blood cells are vital for carrying oxygen, fighting infections, and controlling bleeding. There are three main types of blood cancer: leukemia, lymphoma, and myeloma. Leukemia affects the white blood cells, which are crucial for fighting infection. Lymphoma affects the lymphatic system, which helps the body fight infection and remove waste. Myeloma affects plasma cells, a type of white blood cell that produces antibodies. While the exact causes of blood cancer remain largely unknown, several risk factors can increase a person's likelihood of developing the disease. Age is a significant risk factor, as most blood cancers are more common in older adults. Exposure to radiation and certain chemicals, such as benzene, can also increase risk. Additionally, a family history of blood cancer can elevate an individual's susceptibility. Symptoms of blood cancer can vary depending on the specific type and stage of the disease. However, some common signs include fatigue, weakness, shortness of breath, and pale skin. These symptoms often result from a decrease in healthy red blood cells, leading to anemia. Other frequent symptoms include unexplained weight loss, fever, and night sweats, which can be indicative of the body's immune system fighting the cancer. Diagnosing blood cancer usually begins with a physical exam and a review of the patient's medical history. The doctor will ask about any symptoms the patient is experiencing and look for physical signs of the disease, such as swollen lymph nodes or bruising. A blood test is typically the next step, as it can reveal abnormalities in blood cell counts or the presence of cancer cells. If blood tests raise concerns, a bone marrow biopsy may be performed to confirm the diagnosis and determine the specific type of blood cancer. This procedure involves taking a small sample of bone marrow from the hip bone using a needle. The sample is then examined under a microscope to look for cancer cells and assess their characteristics. Treatment for blood cancer varies depending on the type, stage, and overall health of the patient. Chemotherapy, a common treatment approach, uses drugs to kill cancer cells. Targeted therapy, another option, uses drugs that specifically target and destroy cancer cells while minimizing damage to healthy cells. Radiation therapy, which uses high-energy rays to kill cancer cells, may also be part of the treatment plan. In some cases, a stem cell transplant may be recommended. This procedure replaces damaged bone marrow with healthy stem cells, which can come from the patient or a donor. Living with blood cancer can be physically and emotionally challenging, but a range of resources and support systems are available to help patients and their loved ones cope. Support groups provide a safe and supportive space for individuals with blood cancer to connect with others who understand their experiences. These groups offer a platform to share feelings, concerns, and coping strategies. Therapy, either individual or group, can also be beneficial. A therapist can provide emotional support, teach coping mechanisms for managing stress and anxiety, and help patients navigate the challenges of living with a serious illness. Family therapy can also be helpful in addressing the impact of the diagnosis on family dynamics and communication. Maintaining open communication with healthcare providers is crucial throughout the treatment journey. Patients should feel comfortable discussing any concerns they have about their treatment, side effects, or overall well-being. Healthcare providers can provide updates on the patient's progress, address any questions or concerns, and make adjustments to the treatment plan as needed. Financial assistance programs are available to help alleviate the financial burden that blood cancer treatment can place on patients and their families. These programs can help cover the costs of medications, treatment, transportation, and other related expenses. Social workers and financial counselors can provide guidance on accessing these resources.